Welcome to 2022 Open Enrollment. This presentation will cover important deadlines and information about the many benefits available to you as a state employee. Each year, employees can make new benefit elections or change their benefits during open enrollment. The choices you make lock you into your benefits for the next year unless you have a qualifying event. We'll talk more on this in a few moments. It's worth it to spend some time getting familiar with your options. This year, open enrollment opens Wednesday, October 27th and ends Wednesday, November 17th at noon. During this time, you can use PeopleSoft to enroll in coverage or make changes. Any changes you make in open enrollment are for January 1st, 2022. Before we jump in, we're going to spend a few minutes going over some key terms that are used in insurance and benefits. A lot of this lingo is specific to insurance and not things that we use every day. Understanding these terms will help you to understand the options being offered to you. Number 1, premium. This is the amount that you pay for insurance. The premiums for the options you select will be deducted from each biweekly paycheck. Number 2, allowed amount. This is the discounted rate that in-network providers have agreed to. Going to in-network providers saves you money. Even when staying in-network, it pays to shop around since some in-network providers have agreed to bigger discounts than other in-network providers. Number 3, deductible. All of the health plans have a deductible. This is the amount you must pay before the health plan starts paying for services. Number 4, coinsurance. After the deductible is met, the plan starts paying for services. The coinsurance amount shows how much you pay and how much the plan will pay for services. Number 5, out-of-pocket max. This is the maximum you will pay for services in the year if you go to in-network providers. Once you have met your deductible and paid enough in coinsurance to get the out-of-pocket max, the plan will pay 100% of the allowed amount for services. Number 6, maximum exposure. This is a helpful figure to see how much your health insurance costs when you meet your out-of-pocket max. Your max exposure is the premiums you've paid plus the out-of-pocket max minus any HSA contributions you receive from the state. Health Savings Account, or HSA, is a special bank account that allows employees and employers to make tax-free contributions. HSAs can only be used with high-deductible health plans and can only be used to pay for medical expenses outlined by the IRS. Eligible dependents are persons that can be enrolled in family benefit options. This includes your spouse, children, stepchildren, foster children, legally adopted children, and children whom you have legal custody of. Children are eligible for coverage until age 26. Disabled children may continue coverage beyond age 26 if they meet requirements. A qualifying event is a life event that allows you to make changes to your benefits. Some examples are change in marital status, birth or loss of a dependent, and changes in employment status. Remember, most elections you make at open enrollment cannot be changed unless there is a qualifying event due to federal regulations. We're going to start with a quick overview of what's the same and what's different before getting into the details. First, what's the same? For the third year in a row, employee premiums will be the same. The premium is the amount you pay for medical, vision, and dental coverage. The amount the state puts into HSA accounts on your behalf is also staying the same. We are continuing to offer 3 medical plans: CDHP1, CDHP2, and the traditional plan. Anthem will continue to be the vendor administering the medical, dental, and vision plans. Now for the changes. In the past, when you chose life insurance for both your spouse and a child or children, you've had to pick the same coverage amount as a bundled option. New this year, spouse and child coverage is unbundled, so you can choose different coverage amounts. Coming in January, we'll be switching our EAP vendor to Optum, which will allow for helpful new features like being able to schedule EAP services online and a text therapy option. You will continue to have 8 free EAP services either face-to-face with a provider or virtually. The last change is a big one that we'll be spending some time explaining. New for 2021, we are splitting our current in-network providers into 2 tiers. Tier 1 is preferred in-network providers with the best prices for hospital services. Tier 2 is all other in-network providers. The Tier 1 providers are all part of Anthem's Health Sync program. They have agreed to lower hospital costs and are focused on proactively managing patient health. This tier has the best deductible and out-of-pocket, so the plan starts paying for services sooner. Tier 2 providers are all still in-network providers and a good option. Their costs are similar to what you experience today. Out-of-network providers are the most expensive option. They have not agreed to a visit cost, so there is no limit to what you can be billed. You'll still be able to use any providers you want, and you don't have to designate a provider during open enrollment. You can use a mix of Tier 1, Tier 2, and out-of-network providers if you'd like to. The same services are covered at all providers, but the price you pay for those services will be different if they are Tier 1 versus Tier 2. It is all about choice and helping you to find the lowest cost provider options. Tier 1 Health Sync includes over 65 hospitals and 25,000 providers throughout the state. Health Sync includes all Extension, St. Vincent's, and Franciscan St. Francis providers. On our Open Enrollment page, there is a link to this map and instructions on how to search providers on Anthem.com. Prior to January 1st, you will use a guest login to search for providers. After January 1st, enter your Anthem info either at Anthem.com or in Anthem Sydney app, and it will integrate the tiers into the Find Cost and Care tool. After searching for a provider, click on the Recognitions Tiers link. A box will pop up showing the provider tier and any other recognitions the provider has. You may need to scroll through the recognitions to find the tier. This is an example of a hospital search where the provider is Tier 1. We'll do the same thing on this provider. Click on the Recognitions Tiers link. This hospital is Tier 2. We've talked about how the provider tier can impact your bill. The place you go for care can also impact what you pay. While we're all familiar with the ER, you may not know that it is 11 times the cost of an urgent care visit. Most primary care offices now have after-hours triage numbers to help you decide if you need to go to the ER, urgent care, or if it can wait until the office opens the next day. The Anthem Nurse Line provides the same service 24/7. Being choosy about where you go is one more way to save. Next, we're going to talk about the health plan options for 2022. It's important to keep in mind that the only differences in the 3 health plan options are the premium that you'll pay each paycheck, the deductible, coinsurance, and out-of-pocket maximums. These 3 things are known as cost sharing, and the HSA contribution made by the state. Each health plan option covers the exact same services, has the same prescription drug benefits, has the same wellness program with rewards, and the same provider options. Your big decision is which premium and cost sharing combo is right for you. The three health plan options will look very familiar if you know what we have today. The Consumer-Driven Health Plan 1, or CDHP1, is a high-deductible health plan with an HSA. The Consumer-Driven Health Plan 2, or CDHP2, is a second high-deductible with HSA option. The Traditional Plan, or TRAD, has a traditional deductible and is not HSA eligible. We're going to take a deep dive into CDHP1 since it is the most popular plan. Then we'll circle back to look at the CDHP2 and TRAD plans. This is a snapshot of the CDHP1. Taking a look at Tier 2, you'll see it looks very familiar to what you have today. The Tier 2 deductible, out-of-pocket max, premiums, and HSA are staying the same. New for 2021 is the Tier 1 Health Sync column. When you go to Tier 1 Health Sync providers, you'll have a lower deductible, out-of-pocket, and co-insurance rates. No matter which tier the provider is in, the amount you pay is applied to the deductible and out-of-pocket max of all three tiers. The Tier 1, Tier 2, and out-of-network are not separate deductibles. I know this could sound confusing, but stick with me. We're going to walk through an example next to show you how it all works. Our example looks at 4 visits. These are the steps we'll walk through with each visit claim to see how the tiers work together. First, we'll look at the service. Next, we'll verify the provider tier and get the estimated cost. Then, we'll look at how much has been spent so far in the year. Finally, we'll add up what's due and see where we're at in our deductible and out-of-pocket for the year. For our example, we are assuming it's the beginning of the year and this is the first visit. This employee needs a specialist visit. This employee was able to find a Tier 1 provider. That's great since Tier 1 providers have a lower deductible. This visit costs $100. Since it's the beginning of the year, the employee has not spent anything yet and no deductibles have been met. For this visit, the employee will pay $100 towards their deductible. For all these examples, we'll use the buckets on the slide to follow our deductible progress. The $100 paid by the employee applies to both Tier 1 and Tier 2 deductibles. The Tier 1 bucket now shows $100 out of $2,000 paid. The Tier 2 bucket now shows $100 out of $2,500 paid. This is called cross-accumulating. Whenever you have a Tier 1 or Tier 2 claim, the amount you pay will always cross-accumulate to both tiers. We're moving on to our next visit of the year. This time, it is an urgent care visit. The employee ended up at a Tier 2 urgent care and the cost was $215. We're carrying over the amount spent so far from the last slide. That's our $100 for the specialist visit we just went through. No deductible has been met yet. For this visit, the employee will pay $215 towards their deductible. Even though this is a Tier 2 provider, again, everything cross-accumulates, so the $215 gets applied to both the Tier 1 and Tier 2 buckets. We're now at Tier 1 bucket showing $315 out of $2,000 paid. Tier 2 bucket showing $315 out of $2,500 paid. The employee's third visit of the year is for a biopsy. The employee is seeing a Tier 1 provider. Since this is a higher cost outpatient surgery procedure, using a Tier 1 provider really helps on the visit cost. The visit cost is $3,400. We're carrying forward what we've spent so far on the last 2 visits, $315. No deductible has been met yet, but this visit will meet the Tier 1 deductible. Let's walk through it. Since this is a Tier 1 provider, we start by looking at the Tier 1 deductible, which is $2,000. The employee will pay the first $1,685 of the visit to meet the Tier 1 deductible. We found this amount by subtracting the $315 already paid from the $2,000 deductible. Now that the Tier 1 deductible is met, the employee is in the coinsurance phase. Coinsurance means the employee pays just 10% of the remaining visit cost. 10% applied to the remaining visit cost is $171.50. The total paid by the employee for this visit is $1,856.50. Again, everything cost accumulates, so this amount gets applied to both the Tier 1 and Tier 2 buckets. You can see the total spent for the year of $2,171.50 in both buckets. The Tier 1 deductible is now met, so all Tier 1 visits will be at the coinsurance until the out-of-pocket max is reached, but the Tier 2 deductible is not met yet. The fourth and final example is a CT scan with a Tier 2 provider for $450. On the previous slide, we saw our spending for the year was at $2,171.50. Since this is a Tier 2 provider, we look at the Tier 2 deductible to see if it has been met. It has not been met. The employee will pay the first $328.50 of the visit to meet the Tier 2 deductible. We found this amount by subtracting the $2,171.50 already paid from the $2,500 Tier 2 deductible. Now that the Tier 2 deductible is met, the employee is in the coinsurance phase. The Tier 2 coinsurance is 30%. The employee pays 30% of the remaining visit cost. 30% applied to the remaining visit cost is $36.45. Both deductibles are met. The next visit cost will be based on the provider tier that is chosen. Choosing Tier 1 providers will provide savings on the visit cost. There was a lot of new information packed into that example. It's a new concept for many, and it may take some time to become a pro. The thing to remember is anytime you use a Tier 1 provider, you are saving money through lower hospital costs and better cost sharing. If you'd like to review the example again, you can join one of our upcoming seminars or find a recording of this presentation on our website. This is also a great way to share this information with spouses or adult dependents who are on your insurance. The example was assuming CDHP1 single coverage. Here's a look at CDHP2. Again, you'll notice Tier 2 looks very familiar to what you have today. The Tier 2 deductible, out-of-pocket max, premiums, and HSA are staying the same. Tier 1 HealthSync has a lower deductible, out-of-pocket, and coinsurance rates. Again, no matter which tier the provider is in, the amount you pay is applied to the deductible and out-of-pocket max of all three tiers. And here is your third and final option, the traditional plan. Again, Tier 2 deductible, out-of-pocket max, premiums, and HSA are staying the same. Tier 1 HealthSync has a lower deductible, out-of-pocket, and coinsurance rates. All three plans have the same prescription drug coverage. All in-network pharmacies are Tier 1 providers. The cost-sharing rates in the table start once your Tier 1 deductible is met. Before the Tier 1 deductible is met, you pay 100% of your prescription's cost. Prescription cost sharing is a little different than the medical side since it isn't a straight percentage. Once you calculate the percentage, there is also a minimum and maximum. You'll calculate the percentage and then look at the minimum and the maximum to adjust the amount. Remember, the percentage and minimum maximum do not kick in until that deductible is met. Preventative care services are special. All three plans cover preventative services at no cost to you. This means the plans cover the cost regardless if you have met your deductible or not. Preventative care services are defined by the federal government. Some examples are your annual physical, immunizations such as the flu vaccine and COVID-19 vaccine, and some medications like tobacco cessation products. These are all services to help prevent disease and catch problems early on. We talked a little about health savings accounts when we were going through the insurance lingo. The most important thing to remember is you can only have a health savings account if you have a high deductible health plan coverage. CDHP1 and CDHP2 are high deductible health plans. The traditional plan is not a high deductible health plan. This also means you can't have non-high deductible health plan coverage outside of your state employee coverage, such as Medicare. The state contributes 45% of the Tier 2 deductible into an HSA for CDHP1 and CDHP2 enrollees. Half of this money is deposited with the first payroll in January. The second half is deposited over the next 25 payrolls. You can also contribute through payroll deductions. This is a great way to make sure you have money set aside for medical costs and it is pre-tax. Any funds in the HSA must be used for qualified medical expenses for yourself, your spouse, or your dependent children. It's important to note that the IRS regulates HSA accounts and there are penalties if you use the funds on anything other than qualified medical expenses. Enrollment in any of the three plans gives you access to wellness tools and rewards. The wellness tools include unlimited one-on-one health coaching. Everyone has access to virtual coaching, and many work locations have health coaches that come on site. Health coaches can help you make small changes that have a big impact on your health. Rewards are announced in January, so be on the lookout. If you are enrolled in a medical plan now, it's not too late to earn a $25 gift card for completing your health assessment by November 30th. If you're not sure how to get started, give our benefits hotline a call. Now that we've been through the three health plan options and talked about some of the great services included in your medical package, we'll spend a few minutes comparing the plans to each other. Remember, the only thing that is different with the plans is the premium you pay, the HSA you receive, and the cost sharing, which is your deductible, out-of-pocket max, and coinsurance rates. The CDHP1 has the lowest annual premium and gives you the highest HSA, but it also has the highest deductible. This might be a good plan for you if you are unlikely to hit the out-of-pocket max, and it's still a good option even if you end up hitting it. The CDHP2 has a premium that's a little higher than the CDHP1, but the deductible and out-of-pocket max are lower. This might be a good plan for you if you tend to reach your deductible or out-of-pocket max. The traditional plan has the highest premium and no HSA. The deductible is lower, but you are paying a lot more out of your check each time for this coverage. This might be the right plan for you if you are more comfortable with a lower deductible or if you cannot have an HSA account. Let's look at a chart that pulls all the numbers together for you. There are a lot of numbers on this chart, but it is a helpful summary. The top chart shows amounts for single coverage. The bottom chart shows the amounts for family coverage. This chart shows you the total you would spend in health insurance and medical expenses if you reach the out-of-pocket maximum. It is the worst case scenario and called your maximum exposure. It looks at total premiums you pay plus the total medical expenses you would pay minus the HSA you receive. You can see that CDHP2 has the lowest maximum exposure when out-of-pocket max is reached. You can also see that the CDHP1 premiums are significantly lower and the TRAD premiums are much higher. This information is published on our website to refer to. The premiums in this chart on the previous page were for an employee that has accepted the non-tobacco use agreement. Each year you can elect to commit to being tobacco-free for a discount of $35 on each biweekly premium. When you select this option, you are agreeing to remain tobacco-free for all of 2022, including vaping and e-cigarette products. Employees that select this discount may be randomly selected for testing. If you select this option and you feel you can no longer keep your commitment, you can rescind the agreement, but it must be done before you have used tobacco products, and you have to repay any discount that has already been received this year. A second way to save is by earning the Wellness Premium Discount. This discount is earned in the current year for a discount off of next year's premiums. Enrollees were able to select one of 3 activity paths in 2021 to complete by September 30 of 21 for a discount off of 2022 premiums. If you are someone who earned this discount in 2021, your discount will automatically be applied to your 2022 premiums in PeopleSoft. Be on the lookout for that January email that will share all the wellness rewards available to be earned in 2022. This wraps up the information on the medical plans. We're going to spend a few minutes talking about other benefit options. There are not many changes to these other benefits this year, so we'll cover them quickly. But remember, all of this information is also available on our website. There are no changes to the dental plan this year. The premiums and coverage are exactly the same. This plan works similarly to the medical plans. The coinsurance rates at the bottom of the table kick in once the deductible is met. The exception is preventative care, which is no cost to you. Dental has an annual maximum that the plan will pay. Once the maximum is met, you pay 100% of the visit costs. There are no changes to the vision plan this year. The premiums and coverages are exactly the same. This plan is a little different. Instead of deductibles and coinsurance, this plan works on copays and allowances. An allowance is the maximum the plan will pay for the service. For example, if you choose to get eyeglasses, the plan will pay up to $150 for your frames. If you select frames that are $125, the plan would pay the full cost. If you select frames that are $175, the plan would pay $150 and you would be responsible for $25, the amount above the allowance. Also, please note that you can use either the eyeglasses or the contact lenses benefit in this year. You cannot use both. Maximize your allowances by visiting in-network providers. You can also enroll in or change your life insurance elections. New coverage selected at open enrollment may require evidence of insurability prior to becoming effective. Basic term life, including accidental death and dismemberment, covers 1.5 times your annual salary. The state helps pay some of the cost of coverage. The cost is less than 10 cents per $1,000 of your salary each biweekly paycheck. You must elect basic term life and accidental death and dismemberment to be able to elect the additional coverage options. The additional coverage options allow you to increase your coverage and add coverage for your spouse and children. New for this year, you can select different coverage amounts for your spouse and children. Another great benefit that helps you save money is flexible spending accounts. These accounts allow you to make pre-tax contributions and must be elected each year. Your elections do not roll over from year to year. Make sure you've spent some time deciding the right amount to contribute, since these accounts are use it or lose it. If you do not have enough expenses incurred to get reimbursed for all of the funds contributed, you lose those contributions. The state is paying 100% of the cost of administering this benefit in 2022. There is no cost to you other than the contributions you choose to make. Your flexible spending account options are Health FSA. This is for individuals that do not have an HSA. The funds you contribute can be used to pay for qualified health care expenses that are not paid for by your insurance plans. This would be things like the visit costs you pay before you have met your deductible. The limited purpose FSA is for individuals with an HSA. The funds you contribute have some restrictions before you've met a minimum amount of paid expenses. This is set by the IRS annually. Before this limit, you can only use these funds for dental, vision, and preventative care. After the limit, it works like a health FSA, and the funds can be used for any qualified healthcare expenses that are not already being paid by the plan. The limit this year is $1,400 for single and $2,800 for family. The Dependent Care FSA is for individuals with dependents under 13 years old that will have dependent care expenses, such as daycare or before and after school care. This does not include medical expenses. One more way to save: the Commuter Benefit Reimbursement Account. If you have work-related commuting expenses, such as bus, train, ferry, rail, or van pool, you can contribute up to $270 pre-tax each month to be reimbursed for those expenses. This selection carries over from year to year, so be sure to make any desired changes, including waiving coverage, while making your open enrollment elections in PeopleSoft. And the last benefit we'll talk about today, the Employee Assistance Program. This is a really great benefit. You're automatically enrolled and the state pays 100% of the cost. EAP is available to all full-time employees plus anyone living in your household. EAP is here to help with life events and stressors. You can receive 8 free counseling sessions and also have access to resources and referrals for legal, financial, childcare, and stress. You can use EAP right now by calling Anthem to access services. In January, you'll receive an email about new expanded EAP services when our EAP vendor switches from Anthem to Optum. Look forward to easier scheduling and more options to receive help when you need it. That wraps up this presentation, but we're just getting started in sharing information with you. We have a dedicated webpage with everything you need to know to make the right open enrollment elections for you. You'll also be receiving weekly emails highlighting the different benefits and providing in-depth information. If you have questions, we're here to help. You can reach SBD Benefits through our email inbox or give us a call Monday through Friday from 7:30 a.m. to 5 p.m. The closer we get to the open enrollment deadline, the busier the hotline gets, so make sure you call early.